You're watching CTOM TV. Knowledge is power.
Regardless of the types of cancers you have, it's really important that you understand genetic testing. And genetic testing is FDA approved. There's a couple of companies that have FDA approved genetic tests, such as Foundation One. If the FDA is approving it, they're saying everyone with cancer should get it. That's hands down. So if your doctor says, it's not going to be useful for you. Oh, I don't see how it's going to benefit you, or it's a waste of money. They're not going to find anything. Can you go back?
Oh, sure.
I didn't do the ding. So if they tell you that, then they're going against the FDA's guidelines, and your response should be, well, the FDA has approved it for my type of cancer, and so obviously there's a benefit to it. And you can use examples that we used earlier of BRCA1 mutations, of AKT, mTOR, PIK mutations, and the drugs that target them. There's lots of different examples, and that's just the FDA-approved drugs. There's lots of off-label drugs that you may not know. I mean, you may have NTRK1 overexpression or mutations in your prostate tumor, which would mean NTKR inhibitors or ALK inhibitors. There's tons of different targeted therapies that could benefit you that you can find out through genetic testing and expression testing. So then personalized research has to be real time. You don't do your research and then get your genetic test. You do the genetic testing and then find out what you want to look at. And then you say, okay, I have an AKT so-and-so mutation. And so I'm going to press in the Google search, AKT so-and-so mutation and prostate cancer. And that will give you a huge list of studies of targeted therapies and drugs that will be beneficial for you. So get the data first, spend your money on the diagnostics, and then do your research. So targeted treatment plans, you want to have that well established. There's all kinds of problems with tumor DNA sequencing that you could run into. We'll cover that in a minute. And then there's also new technology called liquid biopsy, and of course PET-CT, as we mentioned, the PSMA PET-CT for prostate cancer. And so liquid biopsies are a great new tool, and what they do is they identify the genetic mutations that are unique to your tumor. So they're only found in your tumor, and you determine that through tumor DNA sequencing. And then we can measure the amount of that genetic mutation and use it as a surrogate for tumor mutation burden. So in other words, or not tumor mutation burden, tumor burden, sorry. We can use it as a surrogate to determine whether your cancer is coming back or whether you're responding to a drug. So typically, if you start a new drug, your doctors will measure the size of the tumor, and then 4 months later, they'll measure the size of it again. If you're paying for that drug and you want to know if it's working, you don't want to spend 4 months on that drug and then find out it's not working. If it's not working, then all of a sudden your tumors have grown and spread, and you've spent all this money, and now you're just in a worse situation. With liquid biopsies, you can find out within about 10 days whether a drug is working or not. And if you're getting immune therapy, it's one of the only ways to tell if you're getting what we call pseudo-progression or fake progression, which is something we can talk about in detail at a different time.
Thank you for watching CTOM TV. Subscribe below and stay informed.